Hi there. I'm Dr. Asmer, but you can just call me Jeremiah. How are you feeling today? All right. And what brings you in? Just a basic physical checkup examination? Perfect. And tell me, has anything changed for you recently? Has you noticed any changes in vision, mood, appetite, motor function, any pains, any nerve pains, anything like that? No? Great. So we're just going to do a basic physical exam. We'll be testing vision, hearing, of course, basic vitals and things like that. But without further ado, shall we get started? Okay. And when was your last physical? About a year ago? Okay. And like I said, nothing's really changed. Nothing that we need to specifically address. Okay. All right. Okay. So the first thing we're going to do is take your vitals. That is, of course, going to include blood pressure, temperature, heart rate, and respiration rate. But I want to say resting respiration rate. Okay? All right. Let's get started. So the first thing we're going to do is we're going to check your blood pressure. So go ahead and put out your left arm, please. Thank you. And actually, let's make sure that as we begin this, we're going to visualize the perfect outcome. So envision in your mind how you would like this entire visit to go. Take a deep breath. Exhale. Can you see it in your head? How it's going to be a perfect, calm, relaxing time? All right, let's make that happen. So again, your left arm, please. Oh, I almost forgot. I need my stethoscope. Okie doke. And hold out your left arm, please. Okay. Relax your left shoulder there. There we go. Thanks. Just relax. Take a breath. Yeah. Okay. And just breathe normally. Okay. Okay. So your blood pressure is 136/64. What does that mean? You're asking me what do the blood pressure numbers actually mean? Sure, of course. The first thing is there's two numbers there, right? So the first number is your systolic blood pressure. That's how much pressure your heart is putting on your artery walls, or your blood pressure on your artery walls during a contraction, when your heart is squeezing the blood. And the diastolic is the blood pressure on your arteries when your heart as it is at rest. And ideally, we're looking at a rate of 120/80 is kind of like the industry benchmark for a super healthy individual, okay? That goes up to 129 is considered, normal and healthy. 130 to 139 is considered stage 1 hypertension. Hypertension is just a fancy word for high blood pressure. So at this point, being is that when I look at you, what I see is a healthy individual. I don't see, you're not overweight. I don't see any obvious markings or signs of inflammation or any other issues that might come up. So even though, yes, 136 is higher than I would like, I don't consider it to be dangerous. I'm not going to prescribe medication at this point. If you got to the 140 plus, that's stage 2 hypertension. At that point, we would consider strongly consider medication. We'd also consider certainly diet changes. I wanted to ask you, so what? How would you consider your diet? Okay. How many fresh fruits and vegetables do you think, how many portions do you think you average per week? Are you able to get them every day? Okay. And how much processed food do you think you get, whether that be, a frozen meal from Costco or any other kind of processed food, fast food, things like that? Not too often? Okay. Very good. So what I'm going to be, my recommendation right now, because your blood pressure is a little high, like I said, it's not something that I'm nervous about right now. It could be genetic, it could be related to diet. Let's keep an eye on our diet, try to limit saturated fats, so stick with healthy fats, raw olive oil, avocado, things like that. Stick with as much unprocessed food as possible, right? And as everybody across the world always says, limit the amount of sugar and limit the amount of processed carbohydrates you're eating, breads and pastas, things like that. It's just something to be aware of. Like I said, you seem like a healthy individual. I'm not too worried about it right now. How much do you exercise? Almost every day? At least a walk or some kind of exercise? Great. Okay. Moving right along, let's go ahead and take your temperature and measure your heart rate. So, I'm just going to have you put this thermometer into your mouth, please. Thank you. And what I'm going to have you do is just hold out your left wrist again. Okay. And slow, easy breaths. Okay. All right. Your resting pulse rate is 67 beats per minute. 67 beats per minute. And 98.2. Great. And 16 breaths per minute. So that all is fantastic. For healthy adults, the range we're looking for in resting heart rate is between 60 to 100 beats per minute. So you being at 67 is clearly on the low side of that, which is an indication of good cardiovascular health, less stress on your heart, and good physical condition. So that's excellent. And just for like a point of reference, you know, the lowest, you know, like an extreme, like an Olympic athlete might have a resting heart rate in the 40s. But that would just be for somebody who is, you know, insanely in good shape. So at 67, you're doing awesome. Okie doke? All right. The next thing I'm going to do is I'm just going to give you a kind of a visual check. I'm going to look for symmetry in the face. What I'm looking for are any signs of abnormal drooping on one side or the other, any nerve pain or sensitivity on one side or the other. And as long as that's not the case, that means you're probably in good shape. Okay? So, okay, let me see your hands, please. All right. Skin feels warm to the touch. And face looks excellent. So the next thing I'm going to check for is called capillary refill. I'm just going to be gently pinching the tips of your fingers, and we're going to see how quickly the color comes back into the top of the nail. Just lets us know how your circulation is doing. So please hold out your hands. Thank you very much. Gentle pinch. Excellent. And capillary refill response is about 2 seconds, which is perfect. Now I want to do a scalp check. I'm going to make sure that there's no pain or discomfort there. Do you mind if I touch your hair? Okay. Hair seems even. No signs of alopecia. And any sensitivity or pain? Great. So your skull is normocephalic and atraumatic, and that is just fancy doctor speak. Normocephalic just means your head is the right size. It's a normal size head. It's a good head. And atraumatic is no boo-boos, no lesions, bumps, contusions, anything like that. So your scalp seems to be in excellent shape. And now we're going to do a basic vision test. Can you see the chart behind me? Great. Would you please cover your left eye? Just cover your left eye. Okay? And can you read this row? Great. And now cover your right eye. Uh-huh. And can you read the same row backward? Excellent. 20/20 vision. And you haven't noticed any changes in your vision, any new blurriness or things of that nature? Great. So now we're going to do a peripheral vision test. What I'm going to do is I'm going to put my hands behind your head, and as I bring them back into the front, let me know when you can see them. Okay? Simple enough. Okay. So let me know when you can see my fingers or my hands. Yeah? And which finger's wiggling? That one? Very good. Let's try it again. And let me know when they come into field of view. And tell me which one's wiggling. That one? Very good. And one more. And which one's wiggling? That one? Very good. Great. Peripheral vision is fantastic. Alright. Now I'm going to put on some gloves. I want to take a closer look at your eyes. And we'll do some light tests. Okay? I want to check out your lenses. Is there any new and exciting happening? Yeah? You got a new job. How's that going? Good, you find it challenging. Yeah. Well, change is always a little scary, isn't it? You know, it's always more comfortable to have the devil you know rather than something new and possibly scary. But I love that you've taken that challenge on, because it's not easy, you know? A lot of people will stay in an unhappy situation because they know it, rather than actually go out and chase their dreams. So good for you. Looking forward to hearing how that goes. Yeah. I've been practicing medicine for about 10 years now. Mm-hmm. I love being a GP. Yeah, I really do. It's fun. It's rewarding. The thing that I like the most is I like working with the families. I like the fact that I get to treat and be with both parent and child. That makes me happy. You're asking what are the bumps on my coat? That's just some fun lights that I did just for when I'm working with the kids. I can turn these on and have a little doctor glow for the kids. That's all, just to be a little silly. Yeah. So I want to check the whites of your eyes. I'm going to take a look at your sclera. Great. And can you look up for me? I'm going to touch the bottom of your eyelids. Okay. And look up. Great. Okay. Your sclera are white, and your conjunctiva look pink and healthy. Okay. Now what I'd like you to do is focus on my nose, right here at the bridge of my nose. All right. Focus right here. Okay, good. Okay, good. And eyes show no opacities or concentric shadows. That's opacities again. It's just fancy doctor speak for there's no junk in your eyes. And the other thing, and that concentric shadow. So if I saw concentric shadows on the nasal side of your lens, that could suggest acute narrow angle glaucoma, which you don't have. And again, focus on the bridge of my nose. Okay. Excellent. Very good. So what that tells us is that your cranial nerves 3, 4, and 6 are intact. No nystagmus. Nystagmus is if your eyes vibrated or moved back and forth or up and down very quickly, uncontrollably. You don't have any of that. Now we're going to go on to a hearing test. So I'm going to start off by using my hands. And then I'm going to stand behind you and I'm going to whisper things to the back of your ears, one at a time, and you'll repeat that back to me. But first things first, I'm going to have you close your eyes, please. And tell me if you hear anything. Out of your left ear. Very good. Out of your right ear. Very good. Both ears. Very good. Now I'm going to go behind you and I'm going to whisper a phrase into one of your ears, and if you could repeat that phrase back to me. Okay? Okay, please cover your left ear. I deserve all the goodness life has to offer me. Very good. And now please plug your right ear. People think I'm awesome, and I deserve all the love. Fantastic. Your hearing checks out. Let me take a quick look inside your ears, okay? Tilt your head a little bit for me, please. And very good. And on this side, tilt your head for me, please. Great. Eardrum and tympanic membrane are clear and pearly gray, just like they should be. Excellent. No inflammation. Okay, now I'm going to touch your face, around your eyes and nasal cavities. Just let me know if you feel any sensitivity or pain, okay? And no sensitivity, no pain. Great. Okay, we're almost done. I just want to examine your teeth, gums, and tongue. Let's take out your tongue, please. And say ah. Great. No obvious cavities. Teeth and gums appear to be healthy and pink. And your uvula rises like it's supposed to. Oh, your uvula is that kind of strange thing in the back of your throat that looks like a little waggle. Yeah, as long as that moves up and down when you say ah, that's what you want it to do. All right, now can you stick out your tongue to the side, please, like this? Yeah, and other side. Good, and up. And down. Great. That means your cranial nerve 12 is good to go. Let me check your lymph nodes real quick. And all I'm checking for here is for any swelling or tenderness. Yeah, good. No pain. No. Lymph nodes all feel healthy and normal. Fantastic. And now I'm going to give your lungs a listen. So, just relax. Oops, just relax for me. And take a deep breath. And again. And one more. Great. Okay. That all sounds great. I'm going to do the same thing from behind you, okay? And deep breath for me. And again. And again. Alright, everything sounds great. Your lungs sound clear and healthy. Very nice. Let me listen to your arteries real quick. So I'm going to put my stethoscope on your neck, next to your carotid artery. Just take a deep breath. Good. And again. Excellent. And now we're going to check your sense of smell, which is the cranial nerve number 1. So, what do you smell? Mint. Very good. And how about that one? Vanilla. Very good. And last one. Let me know what you smell. Lemon. Very good. Now we're just going to do a very simple nerve test. You can see that this side of this little Q-tip is going to represent the sharp side, and of course this will represent the soft side. So I'm going to tap you on different places on your arm and around your face. Let me know if you can feel it, and let me know if it's sharp or dull. Okay? All right. Close your eyes. Sharp, good. Sharp, good. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Perfect. That was your cranial nerve 5 exam, which you passed with flying colors. It basically just means that you can feel if things are sharp or dull. So congratulations. You passed. And next, we're going to look at cranial nerve 7, which is facial control. So we're going to make some funny faces. So smile for me. Big smile. And frown. And puff out your cheeks. And look surprised. Great. You pass with flying colors. You have facial control. And the last test is cranial nerve number 11, which is the muscles around your neck and shoulders. So let me have you shrug up your shoulders. Resist. Good. And let your shoulders relax. And push up on your shoulders. Good. Very good. And put your arms out in front of you like this. And hold them there, and resist. Good. And resist. Good. And resist. Outstanding. Well, that about wraps it up for today. Did you have any other questions, concerns for me? No. Well, in my professional evaluation, you seem to be a very fit and healthy adult who practices excellent hygiene, which we in the medical profession greatly appreciate. It makes our jobs much more enjoyable and much more pleasant. And like I said, the only thing that shows a little bit of worry is your cholesterol is a little high. But considering other factors, your overall well-being, your resting heart rate, and you passed all the other tests with flying colors, I'm not too concerned about it right now. But let me know. Try changing your diet a little bit. Try adding some more vegetables into your diet. Well, how much alcohol do you think you drink? Yeah, I mean, try to limit it to no more than 2 per day. Okay? No more than 2 per day, and you should be fine. And I meant to ask, do you smoke? No? Okay, yeah. Not many people do these days, which is good. And that's about it. So, unless you have any other questions for me, I hope you have a great rest of your day or evening or wherever you get off to. And I look forward to seeing you next time. Just check out with the receptionist on the way out, and you can schedule another appointment in about a year. Until then, all right, take care.